Hi, I'm Gary White for Central Kentucky Television. I'm at Central Kentucky Optometric Associates, and I'm here with Dr. Trish Ciccone. And we have a lot of topics to talk about because October is known for a lot of different things, right? And a lot of people know that it has to do with breast cancer awareness. A lot of people go around wearing pink, but they don't realize sometimes that some of the effects of chemotherapy can actually affect your eyes. Is that right?
Yes, there are some side effects, so I thought we'd touch that. Also, October is at-home safety month, or protect your eyes at home month, and so we want to talk a little bit about that. I thought I'd tie in a little bit of Halloween safety into that and to make sure we keep our kids safe. And then November, we're going to run into the unseen dangers of diabetes in your eyes, so we're going to talk a little bit about that also.
Okay, great. So a lot of different topics to hit upon.
So keeping your eyes safe at home. Almost half of the eye and sight-threatening eye injuries occur in the home instead of at work.
Wow.
Cooking, cleaning, home repair, yard work, even a lot of hobbies all pose a potential sight-threatening hazards. So wearing protective eyewear, we think about it at work. You get your safety glasses to go to work, but a lot of people don't think and don't get in the routine of using safety eyewear at home. And it's really, really important that we do get in the habit of using our safety eyewear at home. Outside mowing and trimming, working the yard, things flying up at you, projectiles coming up at you, using chemicals in your yard. A big danger that people don't think about are power washers. You can have sight-threatening injuries from using a power washer. So you can get that protective eyewear on. Power tools, just a hammer and a nail is one of the leading causes of preventable vision loss. Power, the power nail drivers and the power staplers and all of those are just really, really, really dangerous. Weed eaters, mowers, we've touched on that a little bit. Lots of times when we're around our house cleaning, we don't think about the chemicals that we're using, and a chemical splash in your eye can be very dangerous. Bleaches and ammonias and acids and bases, they can cause some serious and sight potential injuries also.
And rubbing your eyes, even if you're like doing something.
Well, if you touch a cleaner and then touch your eyes, you can have that exposure that way. So get that safety eyewear for not only for work, but get it for home too. If you wear a prescription, we can get you set up with prescription safety eyewear for your home. If you don't wear a prescription, then we can get you set up with some Plano safety eyewear at home. So get that safety eyewear and wear it at home as well as at work.
Because it's also important that they fit.
Yes, absolutely. If they're hanging down and sliding down your nose, they're not going to do you any good. If the stuff is splashing or blowing in around and can fly in around the glasses, then you need a good fit, a good nice wide lens with a nice good wrap, and side shields are a good idea if you don't have a good wrap around there. So let's protect your eyes.
So Central Kentucky Optometric Associates, both in Lebanon and Springfield, can help you tell them what you're doing, and then they can help you come up with the correct
and we can come
eyewear
up, if you need it for outside, the Wiley X brands are great, make great combination sunglass and safety eyewear. We also have some lesser expensive brands and models in style also. So you just got to let us know what you're doing, and we will custom design and fit your safety eyewear to your needs.
Great. Now Halloween, we know, is coming up as well at the end of October.
And we just want to make sure that our kids are safe. Not only do they need to see good behind their costumes, but we need to make sure they're highly visible for motorists. This is a time of year when the number of kids get injured and hurt and hit by cars. It just escalates, and it's the most likely time for that to happen. So your kids got to make sure that with their costumes that they can see well. If your child needs glasses, make sure they wear their glasses with the costume. Even if it doesn't make the costume look as authentic, safety first. They need to wear their eyewear along with their costume, so make sure their costume will accommodate that. And two, we want to make sure that your kids are visible. So, as much as we'd like to wear the dark black, costumes that make them not so visible, that's not such a great idea. Bright colors, bright costumes, reflector tape, And hang some glow sticks on them so that they're easily seen, and so that motorists can see your kids when they're out trick-or-treating and out running around.
Yeah, it's important for them to be seen, but it's also important for them to see. So if they do have a need for some kind of eyewear, then make sure they do have that.
Yeah, incorporate it in with the costume. Just don't say it's Halloween, you don't need to wear your glasses today.
Right.
Because it doesn't look good with your costume. Let's put their safety
first. Yeah, absolutely. Now we were saying too with October with breast cancer awareness.
Yeah, and we want to just tie in some things to think about. These are for most of our ladies and men. Men can have breast cancer also. Is that some side effects of some of the treatments and medications that go along with breast cancer. Tamoxifen is a biggie. Tamoxifen can cause ocular toxicity. It's a low percentage, it's about 6% of patients that are on tamoxifen. But if you're on tamoxifen, you need to let your eye doctor know, and you need to be aware that if you're experiencing blurred vision or a change in your vision while you're on tamoxifen, to come on in and let us get a look. It can cause bilateral optic neuropathy or neuritis. It is just swelling in the optic nerve, and it can also cause decreased vision from a retinopathy. So if you're taking tamoxifen and make sure you get annual vision exams. Usually these side effects occur in folks taking over the 180 milligram per day dosage. So it's usually the higher doses, folks that are at risk for this. But if you're taking tamoxifen, get your annual eye exams and let us know if you're having any trouble with your eyes or vision.
Absolutely.
Another side effect that goes along with chemotherapy, radiation, is dry eye. Dry eye can really make you miserable, and it can be debilitating. It can lead to scarring and to ulceration of your cornea. So, and you don't need to suffer from dry eye. We have some things that we can do to help you. And chemotherapy, a multitude of chemotherapy drugs are known for creating dry eye issues. So. Anybody who's going through that, let us know, and we can give you some help with that too.
And that really goes, since October, we're talking about breast cancer awareness, but for any kind of, your eye doctor needs to know what every other ailment you have going on is as well, because they may affect your eyes from whatever.
Medications and treatments, can affect your eyes and your vision. So, we know what to look for. We just got to know that you're a candidate that needs to be looked for those issues. So don't be shy in coming in and let us know what's going on.
Share the information. Diabetes is another thing that can affect your eyes as well, right?
Absolutely. And November is been dedicated this year to the unseen side effects and ocular side effects of diabetes. So diabetics, you need to keep that and know what your A1C is. I could probably say if I saw 20 diabetics in a day and asked them what your hemoglobin A1C was, probably 19 would tell me that they didn't know what their number was. You got to know your A1C, and you got to keep that A1C down. Diabetic retinopathy. Diabetics have a higher incidence of cataract formation. Diabetics have a higher incidence of glaucoma. But the problem that most diabetics tend to try and ignore is the presence of diabetic retinopathy. Diabetic retinopathy is a microvascular disease that occurs from uncontrolled blood sugar control. It causes permanent damage to the small blood vessels in your eye. And when it's early diabetic retinopathy, often will go undetected because in the early stages there aren't any symptoms. So knowing that you have early stages, the only way you're going to know is to get your eyes dilated, have a great dilated eye exam by your eye care provider. And the more advanced causes cause anywhere from macular edema to retinopathy with vitreal hemorrhages and retinal and iris neovascularization and permanent profound vision loss. But there are treatments for diabetic retinopathy when you get to those moderate and advanced stages or develop macular edema. So it's very, very important that you come in regularly for the dilated eye exam, and so that we can detect those things and get you your treatment when it's appropriate for that. And keeping that A1C number down. You got to know it to know if you're controlling it. know your A1C when you go into your doc's office about every 3 to 6 months, and they take that A1C instead of just hearing, yeah, it's okay, so you're doing fine. Ask them what your A1C is and get to know that number, so that when you come in to see your eye doctor and your eye doctor asks you, because they're going to ask you what your A1C is, then make sure you know what that number is and when it was drawn last.
Absolutely. And again, that's something, if you are diagnosed with diabetes, be sure to share it, the information.
Absolutely, absolutely.
So they can have. Well, thank you very much. Some great information, again, from Dr. Trish Ciccone with Central Kentucky Optometric Associates. And Central Kentucky Optometric Associates has offices both in Lebanon and Springfield. So give them a call, get an appointment, get your eye protection wear for everything you're doing at home. Be sure to be seen for Halloween, and for all your different medications, let your doctor know, so there might be some side effects. Thank you very much.
Have a good day.
All right. It's been Gary White for Central Kentucky Television.